The first thing governments need to do is make an absolute commitment to ensure that insulin is available to all who need it. Because, of course, if it's not available, people die. And that is something governments need to do firstly. Once they've made that commitment, then the mechanisms for procuring and supplying and distributing the medicines come into play. And finally, the issue of cost, that for poor people, if they die because they can't afford the insulin, that's just as serious an issue. So ensuring the affordability in addition to the availability is what governments need to commit to do. Many countries, many organizations procure by tender, where they ask companies or wholesalers to bid and to say what price they would sell the medicines at. Once that price is determined and the price is awarded, it's a public price. And that price needs to be shared with other countries, with other organizations, so people can know what is the global market. Because what often happens is the supplier knows the price, but the purchaser in other countries doesn't know the price, and they can easily pay 3, 5, 10 times as much for exactly the same product from the same company, even with the same batch number. So transparency empowers the buyer. Work that Health Action International did in the UNRWA, the Palestinian territories, where they were paying a lot more for insulin. They were still getting a good price, but it wasn't the lowest price that was available in the region from Novo Nordisk. Once UNRWA was empowered with that information, they were able to negotiate directly with Novo Nordisk, get a better price, and with the hundreds of thousands of dollars in saving, they were able to improve the purchase of other medicines, particularly simvastatin, for treating patients with heart disease or diabetic complications, heart complications of diabetes. So hundreds of thousands of dollars were saved